Hi, Mike Gibson here with my good friend and colleague, Holger Thiele. And Holger, we're talking about the 12-month results of ECL-SHOCK. Talk to us a little bit about the primary results and then what you found at 12 months.
Yeah, very interesting data, honestly. So as you know, we presented last year the 30-day results of ECL-SHOCK, which compared VA ECMO versus control in patients with severe cardiogenic shock. And as you all know, this has been discussed in much detail that there was no mortality benefit at 30 days follow-up. And now in the meantime, as you know, we have the Danger Shock trial, which showed a mortality benefit at 6 months follow-up, whereas at 30 days, there was no benefit. And that's the reason why we had a predefined secondary endpoint at 1 year follow-up. And yeah, we did not see any benefit of VA ECMO also at midterm follow-up at 1 year in comparison to control. So the Kaplan-Meier curves are totally overlaying. So there's really no benefit at all. And also there's no subgroup having a benefit from VA ECMO in comparison to control.
And how do you reconcile these results with Danger Shock, Holger?
Yeah, this is still open discussion. So I personally believe this so we can discuss it. We don't know. So maybe it's the device itself, that the ECMO is increasing the afterload, that the ECMO is not very beneficial to the heart, which is different maybe to the impeller device, which is unloading the left ventricle, which in comparison to VA ECMO, which is more a loading device, at least in few patients, depending on the hemodynamics. So this may be one of the reasons. But if you ask me, probably the most important point is patient selection. So in our trial, we allowed that patients having undergone resuscitation before randomization were allowed to be included. And because we had a lactate of more than 3 for inclusion, this increased the risk of the patients, but this also increased the overall number of patients having undergone resuscitation before randomization. And in the end, this was also a surprise for us to see we ended up with 77% of the patients having undergone resuscitation before randomization. And maybe this is one of the key issues for the difference between Danger Shock and ECL-SHOCK. This is at least what we try to explain regarding the interpretation of the results.
Great. Well, Holger, congratulations again on such a tough trial. It took about 10 years to complete. Now you've given us 1 year follow-up, a lifetime's work. Job well done. Thanks for joining us today.
Thank you. A pleasure.